So I'm just going to do a very quick review of some of the series we've had this year. And I'll start off with the local leadership series. Like I said, I feel in HSB, we have a three-pronged theory that by fixing leadership, by fixing the understanding of the market and how the market operates, and also by fixing the system, like the systemic barriers, like policies and all of those things, healthcare can be better for patients globally. And that is why our podcast series has taken this three-pronged approach. In the local leadership series this year, we are very opportune to have a very special guest in person of Dr. Ninaya Kalu, who is a head or leads in the Nigerian healthcare insurance scheme. I think learning from her was one of my highlights, and I think you should listen to some of my highlights from her.
I'm sure you're not a local leader, you are a global leader in terms of like healthcare. You're all over the world. But I'm just curious to know what local leadership has meant for you, both in the high places in your career and how you build and how you show up for patients in the world.
Yeah, so thank you so much for that question. And local leadership for me, it brings to mind two things. I mean, the context and also the systems. So you have to really understand the situation around you. What's the context? What are people going through? What are the pain points? Are there barriers? Are there enablers? Are there allies you can rely on? So once you understand that, and you know, for you to do that, it takes sometimes getting off your high horse, dropping whatever thoughts and ideas, whatever you've thought about before, and just sitting with the people and understanding what they're going through. So, because you can't design an intervention without really understanding the people. So, and no matter what degrees, I mean, best practices are wonderful, but you need to integrate that with what's on ground as well for sustainability. And then for the systems, you get to realize over time that you can't do everything yourself. There's no way you can't do everything yourself. So therefore, you must have systems, you must have people, you must have teams. Put all those together so that even in your absence, things keep running. So that's really, really important as well.
Thank you.
It's not just about the title. You don't need to wait for your turn until they hand you a title and say, yes, now you're a leader. And then you begin to wonder, where do I start? No. And you start from where you are. I mean, you can lead horizontally, you can lead vertically, both up and down. It starts by, and you know, you can transfer leadership skills from, different places. I've been a children's Sunday school teacher for about 20 years as well. And for you to teach children, you need a lot of patience. And I wasn't a very patient person initially, but I had to learn and transfer that, I use that as well at work. So that's one of the things. And then I mentioned learning, unlearning, and relearning. So having that learning mindset also helps you as well. Don't always think you're right and you know it all. No. You can learn from just about anybody. Another thing is working with people, getting along with. If you're looking at results, you don't always have to like everybody, but you need to learn to work with people. That's really important.
So as you can see, this is the best channel to learn from best leaders across healthcare. Also, this year on the local leadership series, we also have the opportunity to have Dr. Idong Esiet Gibson, who I personally think Dr. Idong is a phenomenal woman. I personally think she's a phenomenal woman. She's someone who, I'm inspired by daily. I think her journey, 21-year experience, not more than that. I think, why am I saying 21? 31-year experience in healthcare, and having her to sit, to share some of her biggest lessons and experience in healthcare was not just heartwarming, but I think it's a valuable opportunity to learn from somebody who has done the work and has walked the talk. And I learned some of her golden lessons on leadership, and when culture meets science, right? She talked a lot about how, the cultural context differ, and, just learning from her journey across different global health terrains, risking her life in the peak of COVID, Ebola virus. I think that was very phenomenal, because leadership is all about setting example. I can imagine being sent to the field to, go and go and check patients who have Ebola. I think she did a phenomenal job there. And I really want you to listen to some of her top lessons in 2025 and through her career to watch it.